Hello.
Uh, Hello everyone. Welcome to the 38th episode of our webinar series COVID-19 and Social Sciences. In this webinar series, we discuss how social science knowledge and practice can be used to tackle this COVID-19 and post-COVID-19 situation. We have not limited ourselves to the social sciences only. We have invited scholars, academicians, practitioners from natural science and biomedical sciences also. In our today's discussion, we have invited four distinguished guests and the scholars and academicians to discuss on the COVID-19 situation and post-COVID-19 situation from their academic and research perspective. So, first of all, I would like to invite Dr. Nestor Castro, Professor of Anthropology and former Vice Chancellor for Community Affairs of University of Philippines, Diliman, and Dr. Sabina Faiz Rashid, Dean and Professor of Bragg James P. Grant School of Public Health and Vice President of Impact, Bragg University. As well as we have all-time favorite, A.K. Majhur Islam, who is a professor of anthropology at Sharjah University of Science and Technology and executive director of Institute of Applied Anthropology. I would like to welcome Dr. Daroni Fukau from the Department of Society and Health, Mahidol University, Thailand. Welcome everyone to our today's discussion.
Thank you.
So, like the previous episodes, I will start with a micro level question with which our audiences are quite familiar. So, I will start with Professor Dr. Nestor Castro. So, my question is to you: how do you evaluate the COVID-19 situation from your personal and academic perspective, sir?
Okay, good evening to everyone listening and watching right now. So, in the world today, we're witnessing a global pandemic of COVID-19. And particularly in the Philippines, just like in your country, we are very much affected by it. We in Metro Manila have been in lockdown since March 15th. So I'm just at home. I cannot go out. I'm on quarantine, even if I haven't been tested yet. So many Filipinos are in a similar situation, just like me, uh, that we want to do so many things, but our life has changed because of this pandemic. There is a lot of restrictions imposed by our government. And maybe this is where I could say that the Philippine government does not consult social scientists in looking at Filipino behavior. So that's why the government has been blaming many Filipinos for being undisciplined. Why is it that they go out despite the problem, go out of their houses, but the government hasn't really studied the behavior of people? Our government, unfortunately, has adopted a military solution by deploying military men and policemen at checkpoints in order to prevent people from going out of their houses. And our president himself has made a pronouncement that he is ordering the military to shoot people who violate this lockdown. So there is no clear understanding as to why people behave that way. And it is social scientists who are in a position to know and understand Philippine culture, Philippine social and psychological behavior, especially at the time of a pandemic. However, social scientists are not being tapped by the government. So this is my initial reflection. I don't know if I should further expound, or do we want a discussion right now?
Yeah, we'll get back to you once again. Sudipto, it's back to you.
Okay.
Thank you, Professor, for your introductory comments or statements. So now I'd like to go to Professor Dr. Sabina Faiz Rashid, ma'am. So, ma'am, my question is to you that how you are going to evaluate the pandemic situation from your personal and academic perspective. Ma'am,
Sabina,
please
please
kindly
unmute your
unmute.
yeah.
Sorry, I'm sorry. You know, this happens all the time. I apologize. So, what I wanted to say is that we are living in a crisis, a global, a local crisis. And I will talk about the personal later, but I wanted to say something picking up from our Vice Chancellor Castro's point, which is public health traditionally or conventionally public health is very biomedical, or the emphasis is on prevalence and surveys. But one of the most important things in social sciences, and this is where we come in as anthropologists or in interdisciplinary approaches, allows you to understand context and communities, because these are diverse. You know, if you look at urban poor, remote rural, where you live, the communities that surround you become your trust, your networks, you build relationships with them. So the challenge, first of all, is the approach to coronavirus has very much been around an individual determinant of a virus that impacts on your health. But the reality is for many people, even in the Philippines, but also if you look at the US and many countries, you've got a disproportionate number of marginalized groups who are being affected in various ways. So particularly if I take the example of our research in informal slum settlements, people, there's about 5 or 6 to 12 people living in one household. They share communal water. They share communal latrines. They don't have money to buy soaps. Some of them may share a mask. So that's one level of contextual realities matter, and it's very difficult for people sometimes to follow national guidelines that do not sit in their own local environments. For the middle class and the well-off, we have the ability and the capacity to sit in our apartments and maybe follow some of those guidelines. But for the poorest who are worried about income, hunger, jobs, and getting these messages, which is important, they try and balance, and they have a lot of distress. Emotional and mental distress is brought about by these challenges. My second point is, if we're going to look at context, I think it's very important to understand communities. Communities are heterogeneous. They're not a homogeneous group. And if we don't understand what are local meanings around what we mean by distancing, does that mean when you come home, you keep distance with your family members because you see them as outsiders? Or do you keep a distance from external people? Because these, even though we get messages, if you get too many messages, and I'm sure Professor Daruni will speak to this, it gets lost in the overwhelming notion of information. And I think it's critical that we recognize these contextual realities. We also need to understand health realities, lived realities, but also risks. What are perceptions of risk? For me, health is a reality, being well off, living in an apartment. But for someone who's poor, they're managing dengue, malaria, maternal morbidities, infant deaths. It's a day-to-day, everyday challenge. Along with that, for many of them, it's basic survival. Social science is very useful if done properly, because I'll give you a quick example. We did a survey. We're doing about 24 different kinds of studies, COVID related. And we did a survey of about 1,500 and then 3,000. And what we found is when we asked the households, do you have any cough, cold, fever, any symptoms to report? They said no. We did follow-up qualitative phone interviews. Guess what? In the qualitative phone interviews, we found out there's a huge stigma and fear around coronavirus. And they were scared that if they told the interviewer on the phone that they have a cough or a cold, they might be in trouble, they might be taken away, they might be put in self-isolation, all kinds of fears that are not based on reality, which means that there's a huge health implication, there's underreporting. So if I went with the survey, which is very important in terms of it answered many other questions about income, food consumption, or if I look at health-seeking behavior, but if I look at health realities from an anthropology, sociology, or sort of a qualitative perspective, Social sciences sheds light about there will be huge underreporting because there's stigma and fears around coronavirus. And that ties into risk strategies or risk communications. Because if we don't address that, and as the Vice Chancellor Castro shared, we don't understand why people behave the way they do. And information has to resonate and be relevant. Short information that doesn't say don't, because we've been telling people not to smoke and drink for years. That hasn't changed behavior, right? It's about this is the reality. And one other point from a social science perspective, I wanted to add my final point because I know others need to speak, is that it needs to be human-centric. And sometimes a lot of data, I wanted to share this, is that what counts as data? What is evidence? And social science has a huge, huge role to play to contribute on data to respond to this epidemic, to respond to future epidemics, and can design programs, communications, and other forms of interventions, be it service delivery organizations or government, in a very nuanced way, contextually. Secondly, it has to be relevant. The reality of social sciences, it's not a linear model. We change questions. We look at different kinds of perspectives. There's a lot of reflexivity and reflective critical thinking, which allows you to ask more questions, address certain issues that have come up that we may not have necessarily thought about when we're designing the original question or the themes that have come up. Finally, I think interdisciplinary approaches is critical. And I'm going to end with that because I think you need different sciences and social scientists to come together. Epidemiologists, biostatisticians, anthropologists, psychologists, people from different fields to come together, because this is a time more than ever where we need different diverse perspectives to inform data, the design of data, which has to be human-centric. So bottom-up designing of data, because the risks are very real of this pandemic continuing, coming back, or other forms of pandemic that are going to hit this world in Bangladesh and Philippines and Thailand. And there's real economic, social, mental, emotional, and individual human consequences. And I'm going to leave it at that. Thank you very much.
Thank you, Professor Dr. Sabina Faiz Rashid, ma'am. Ma'am has pointed out a very fine issue, which is that perception of risk. So, how the people, the perception, what is the perception of risk in this pandemic situation of people? If we can find out that from it could be an good work. It can be a good ethnographic work in that on that issue, because Ulrich Beck has mentioned about the risk society. So if we can find out that how the peoples are perceiving the risk, then we can find out the answer of Professor Castro, that why people are behaving like that. So thank you, ma'am, for your informative introductory discussion. Now I'd like to go to Professor A.K. Majhur Islam, sir, that what are the new thought in this pandemic situation from your side, sir? So can you unmute, please?
Azaba, you have to unmute your microphone.
Well, I it can again muted. So are you hearing now? Can you hear me? Okay. All right. So thank you very much, dear panel. I mean, I really welcome Dr. Castro, Dr. Daruni, and of course Professor Sabina Rashid. This is one of the effort that we have been taking during this COVID-19, that we kind of discussing with the greatest mind around the country and beyond, how they are thinking about this COVID-19. So for me, it's been kind of difficult because I have to speak every single day, so I don't have much new thought for every day. But you know, what I perceive right now is that we are in the middle. It started in November, and it's about it's June right now, so it's about 6 months that we have been going through this COVID-19, which is called the unprecedented a pandemic in the history of humankind, because the other epidemic that took place was not combined with this infodemic kind of a thing on this net globalization or kind of the global village that we are having right now in the planet. So this pandemic has got is very new kind of a thing, and for the first time in the history of the world, you see that the pilgrimage in Mecca has been postponed, and the Olympic that is being postponed. So this kind of indicate that this is unprecedented in the history of humankind. So having this thing said, that since we are in the middle, the Institute of Public Health in Harvard University is saying that it is at least another 2 years that we need to adopt with this situation. We need to go with the situation that we are having right now with this mask and sanitizer and etc. and etc. So, but you see this opening economy is opening right in Bangladesh as well. That we are kind of, we call it a slightly open up of our life, but this has got a huge struggle now, how you need to cope with this situation. So we can call it from a social science perspective, that's a deep adaptation. We adopted in many ways, but now we are having this deep adaptation right now, how we can adapt with this new situation, having this COVID-19 in our kind of scenario. So the question that comes to my mind right now is that you see the inequality was always there. The adaptation was always there. Human survival with that people are telling nowadays about Darwinism, that survival of the fittest, who has got the a good immune system and good adaptive system, they can survive more than the others. So having this thing in mind, what are the new kind of strategy that we can adopt? Because inequality was always there, but there would be deep inequalities. There is a projection. There would be xenophobia in different parts of the world, because we have seen the vices and the shortcomings of this new liberal economic system that is there in the world. And this global south and global north dichotomy that always have been a kind of a thing in this world we're seeing that this is not working that much. We are not depending on the global north that much, because global north is not doing that much to the global south. And we're seeing this even during this pandemic, how racism has emerged. We see the Floyd case in US. So this is a total chaos in the whole of the world. So what is the best thing that we can take from this chaos? What we can look forward? What are those finer strategies that we can adopt for what is the learning that we can have during these 6 months? Because every day we are learning. So what are those learnings that we can adopt to have that deep adaptation and with that finer adaptation for when we confront this COVID-19? So that's my take for now.
Thank you, Professor K. Majid Islam, sir, for your nice introductory statement. Now I'd like to go to Professor Dr. Daruni Foucault for her introductory statement. So, ma'am, my question is same to you all, that what's your standpoint or what's your understanding or evaluation on this COVID-19 situation, ma'am?
Just give a short introductory, like I come from mental health background. Okay, hang on. Can you hear me?
Yes.
Can you hear me?
Yes.
No?
Yes, we can hear you. Daruni,
yes.
We can hear you.
Oh, yep. All right, good. All right, so I just give a little introduction about myself as a faculty member in Department of Society and Health, and I got mental health and psychotherapy background. I think like the COVID-19 I think give a lot of people like upset to like this COVID-19 pandemic, like for me as well. So many familiarity pattern of how I live my life has been interfered. Like I used to depend living on a lot of people, but in COVID-19 I have to depend on myself, blah blah blah. So I think that this time is good for us to good time to reflect on our assumption. Okay, try to rethinking the rule to live a life, okay, as a person, or like rule to live a life as a mental health academic person, how I can contribute myself to benefit to others. Okay, just short introductory from me.
Thank you, Dr.
I know, Sudipto. I know that Dr. Daruni has got a study on the students in Thailand, and she wanted to focus on the mental health issue only. So when you come to the second round, you can ask her only about the mental health issues in Thailand. And I know Professor Rashid needs to go. She has got another kind of a Skype call to attend. So can we go back to Dr. Rashid now to have his remarks first on some of the exit plan that we know how the situation is there in globally and nationally. So what from a social science perspective, do you have any kind of a point that you want to make, how we need to adjust those health and economy together, and we need to have an exit plan from the pandemic?
If I had all the answers, I wouldn't be sitting here as a professor. I would be, doing much more. But I do think there needs to be a lot of critical thinking and strategic thinking, because if we're going to, and I'm talking generally, if you, let's say you impose, I was hearing about the Philippines, a curfew style lockdown, then we need to ensure that people have food, people have economic stipends, people have some kind of relief as they wait for jobs to open up. It's a complicated situation because businesses are also being affected, right? We employ factory workers, we employ, transportations at a standstill in the country. I think going forward, in at least in the Bangladesh context, there needs to be some real thinking done, because if now we're opening up, but do we think about, through research evidence, dividing the country up into zones where there's high risk areas and low risk areas, and thinking about what kinds of strategies or interventions are required, where it's 100%, let's say we have 100% masks, the distancing, XYZ, hand washing, but to maybe not shut economies everywhere, because we know there's certain parts of Bangladesh that are still not as affected and remain still low. Our challenge is, like many countries in low middle income countries, is we have very low levels of testing. So whatever testing we're doing, though, we're finding infections, but there's still low deaths. I would say social science can play an important part with epidemiologists when they look at aspects of behavioral, when you start implementing interventions, what's working, what's not. Maybe that can feed into guidelines for employers who run factories, feed into offices that are going to open up. How do we kind of ensure some of those spaces? How do we understand what the dynamics are for people who adopt practices, and how do we ensure they continue to adopt certain practices? Countrywide, we're in a very complicated situation. Many countries are struggling. Unless you're Sweden with very few people and a lot of money, we're in a bit of a, we're dealing with I think a global national humanitarian crisis. And it's, as Professor Mazar was saying, it's something that's never been seen, unprecedented, at least in my lifetime. And I would say that working across sectors is very important. The private sector, the public sector, bringing in education, ministry, health, because it's not just about health. It's about improving health systems, but it's also improving educational institutes are going to open up? What are the approaches there? Factories have opened up. What are the approaches we have? Because people are going to go out there to work. People are already working. Many of the poor are wearing masks and working. How do we prevent the vulnerable groups? Because there's a real link between mobility and transmission. So how do we kind of work across sectors? And I would say that the reality is some people will die. We also need to have some firm directives and policies without, listening to the Vice Chancellor Castro. It has to be sort of engaged with in some ways, because if it's very much do this, do that, as the Nobel Prize Banerjee said, many poor people will break and violate lockdown just because they need to eat. So I think we're dealing with a very complex situation, but what are some of the basic strategies and steps around basic communication, risk messaging? How do we ensure food? How do we ensure stipends? How do we ensure relief is fair and equitable and distributed fairly? I mean, some of the things that we need to kind of galvanize and capitalize on is very, very important. I'm sorry, Professor Mazar, I don't have a magic response, but it is a complex and critical situation. And many, many people, especially the poorest, are very affected. And I was going to go back to this, Professor Daruni, I apologize, I'm going to miss your mental health research that you're finding. But mental health across all groups, and particularly young people and students, is a huge issue. We need to address that. And as you know, Professor Mazar, in Bangladesh, mental health is a stigma. We don't talk about it. We don't deal with it. We don't address it. But if your emotional mental state is not okay, everything else also has an impact on your family, on your spouses, on your parents, on everything. And I think that is a very, very important point. But we tend to forget that with our emphasis on virus, which is a real threat. But if we don't, address some of these issues, I think, so really, really a comprehensive approach and a very critical approach, and working across sectors, I think. And private sector needs to be included in these discussions, very much so. Thank you. I hope this responded to your questions. I apologize, I have to leave. And I didn't,
Before you leave, Professor Sabina Rashid, do you think that herd immunity is the option for Bangladesh? Do you think that?
I'm not going to give a very generic response, because I think it's a very, very difficult question to answer. I think the reality is there's many people now on the streets, right? They have to work, they have to live, or they're required to report to work. Now that will take place anyways. I think we need a multi-pronged intervention along with that, because you can't shut down an entire country for years either, right? We shut down March 5th, we're looking at June. So if the pandemic or the epidemic is around, do we shut down for 2 years? Or do we do it phase by phase? Do we look at interventions? Do we do it step by step? Do we address high-risk areas differently in terms of interventions, and low-risk areas start getting prepared? Do we shut down entire economies across an entire 64 districts? I mean, I think some of the realities, herd immunity will take place. We are 170 million. But how do we address it in different ways, multi-pronged approaches? And we have very vibrant NGOs, we have civil society, we have a lot of actors here along with government. So I think we need to be realistic, but realistic, but also critical thinking and responsible accountability from all the ones that are in charge and have a say. But we also have to realize that we are also a developing country, and now is more than ever required for timely, effective responses and discussions around these issues, because many countries are grappling with it. I look at the USA, it's a joke, and that is the superpower, or was, but I'm saying, so I think we need to also keep that in that context. I hope that answers your question. As I said, I don't have easy answers, otherwise I would be out there doing more work than just this. Yeah. Thank you very much.
You so much. Thank you very much, Dr. Rashid. So you feel free whenever you want to leave. You feel free to leave. We'll go to Dr. Castro now.
Apologies again to everybody. This was a prior commitment from a week ago.
We are so glad you can make it, because you have got multiple programs today, but finally we could make it. We're really grateful for that. So feel free to leave anytime.
everybody's busy, and I'm so glad and I was honored to be part of this webinar and listen to experts. Thank you very much.
Thank you.
Bye-bye.
Thank you.
Now, as Professor Dr. Sabina Faiz Rashid has some other meetings and works to do, so important
Thank you.
one. So that's why she has have to leave this discussion, but we will continue our discussion. So now I would like to go back to Professor Dr. Nestor Castro. So I would like to ask a question from your statement that you have made in your introductory statement, that why people are behaving like that. So if we look this behavioral condition of people in this pandemic situation from cognitive anthropological perspective, so do you think there is a connection between this behavior in the pandemic situation and the social and cultural introduction to the people we have got after in this long time? So do you find any kind of interrelation between this?
Okay, can you hear me? Okay, so definitely there is a connection. There is actually a conflict between the people's mindset and those in power. I'm referring to the state as to how they understand the concept of illness, how they understand the concept of a pandemic. Let me cite the Philippine example. So in the Philippines, when we say illness, and our native term will be sakit. This is the same term as in Malay, sakit. It means there would have to be symptoms of that illness. But in COVID-19, we know there are COVID positive patients who are asymptomatic. Now, people don't understand that because their view of what illness is, it has to be some manifestation. And I am quite surprised that even among our top politicians, they would say, no, I feel well. So why would I wear a mask? Why would I stay at home when I don't feel anything bad? So this means the mindset, the traditional mindset, is still embedded on people's consciousness. Now, one role of the social sciences is bridging this gap between two worldviews. How do we make policymakers understand what the people feel, and at the same time, how do we bring back the message to ordinary people? So this is one challenge to social scientists, and it would have been better if government planners and policymakers tapped the expertise of social scientists. Secondly, while this is really an unprecedented event, of course, we also have to learn from our history. The past probably big global pandemic was the 1918 Spanish flu. Of course, that is already lost in the memory of many people. But we have historians, and historians have studied how people responded to such a pandemic in the past. So historians could be tapped into what did we learn from the past? What did people do in the past in order to overcome the situation? What were their failures? And how do we learn from it? Again, this was just swept under the floor as if it did not exist. Now, one big difference between the pandemic then in 1918 and at present will be the presence of an interconnected world through the internet. And we learn from the experiences of other countries. We don't just learn from what is happening in my own country, but what is happening in Bangladesh, in India, in Thailand, etc., etc. So we do not have to copy a particular model. Unfortunately, in the Philippines, our government is trying to copy the example of China. But Chinese culture is very much different from Filipino culture. So there may be good experiences in China, which we can borrow. There may be good experiences in Vietnam, which is quite surprising, and Taiwan. So we have to learn from these things, and the internet and social media connects us together to learn from these experiences. Now, this is why I'm quite uh, critical of the term social distancing, because the World Health Organization uses that term. But because actually what we really mean is, let us prevent physical distancing. But during this time of pandemic, we have to be socially connected with one another. It may not be physical, but it may be through internet, because we know
Mm.
that social connection enables us to heal at a faster rate than if we are alone in a particular problem or illness.
Thank you, Professor. So now I would like to go to Professor Akem Alshristan, sir, that you have talked about the protest on the death of Floyd in USA. So do you think that the protest that is happening in the USA, it will uh, it will be a very bad side in the COVID-19 situation in the USA. So it will create a very bad impact on the COVID-19 situation, because the protesters are coming to the roads and they are not maintaining that kind of hygiene or the distancing, physical distancing. So what could be the impact or on that issue, sir?
Thank you, Shudipto. Yes, it is a concern because hundreds and thousands of people are on street in different parts of US, and US is a big country, and 36 states have been under kind of an injunction that people are not allowed to um, roam around in the street, but people are protesting even then. So that's there is a good and bad on that. I mean, from the health perspective, of course, it has got some risk on it, because they cannot maintain that physical distancing that is advised by the by WHO, and from the biomedical perspective, that will deepen the crisis of COVID-19 in US, because we have been seeing that in US COVID-19 is a devastating kind of a situation, particularly in New York. That was an epicenter for many months, and we have seen how US, particularly this administration, I mean the Trump administration, is comprehensively failing to adopt this situation of COVID-19. And furthermore, this procession around the country will deepen that a lot. But the positive part is that people are even having their risk, even they're having health risk, they're protesting. That's the good part of being Homo sapien. I mean that's the good part of the humanity that Homo sapien has. That still today, I mean, even during the pandemic, they are protesting for a valid cause. I mean, this, and it is unthinkable. I mean, how many lives um, uh, have been sacrificed, particularly in the country of USA, for this racism thing. I mean, for the I mean legal rights and different kinds of rights for the black people in US. I mean, you can name, I mean, Malcolm X and Martin Luther King, and many other who has sacrificed their life for the rights of the African American people in US. So it is not really I mean in a time like this, and in 21st century, where USA is preaching the kind of a freedom and human rights around the world, and in their own land they're doing all this kind of thing, and that's kind of a shame for humanity, what has been happened in Minnesota, Minneapolis. So but the brighter part is that people are protesting. That's even during the COVID. So that's the brighter part of it, and not only in the US, but we have seen the protest and goes on in many countries in Europe as well, and that people are protesting this thing. So this is, I really appreciate this part of the spirit of the Homo sapien. I mean the human race. But again for during COVID situation, the question that you have asked, that of course it poses some risk for the US population, that they're and we're seeing this kind of riots and kind of looting in the kind of situation, I mean incidents there. That's also not appreciated. I mean when it comes to protesting, it should be a peaceful protesting. I mean the spirit is important, that we are not with this kind of happening even any place in the world, not only in the US. So I'll just take one last comment on the COVID-19 in Asia. I mean, we have got our friends from Philippines and the Thailand, and we have seen that both of the country has managed it little, I mean, in more efficient way than the others. I mean, I'm not really very sure about the Philippines scenario. Dr. Castro will be able to clarify as more into that. But I know some success story of the Thailand, because we anticipated that, since Thailand is one of the hubs in this area of Asia, that people from around the world comes in Thailand for many reasons, and so we anticipated that Thailand would be one of the worst affected country in the region. But we have seen that Thailand has managed it very well. I mean, their death ratio is very low, and I mean they have managed it very well. So probably Daruni will be able to say a few words on that. But my point is that, since SARC is not working very well, as you've seen, that we are living in a world where we cannot live alone. We need a regional kind of a cooperation, where we can do our things better than if we can do it individually. We see that we can do it better. And virus and pandemic like that, is it not a one country business? Virus doesn't have any passport or visa. They just enter into any given country in the world. So if we can do it regionally, it would have been much better. But you have seen that SARC is not working, ASEAN is not working, and any kind of that regional thing is not working. So I'll also ask Dr. Castro if he can shed some light on how we can be more proactive regionally. So with that, I'll stop now.
Thank you, Professor A.K. Majid, sir. But I have a question. It's from my curiosity, though it is not related to COVID-19. But my question is that, is there any chance of being politicized, the protest that is happening in US, because the election is very near, and it will take place in this year in USA. So is there any chance of being politicized of this protest, Professor?
Your Professor Castro.
Sorry, it was addressed to me. Sorry.
Yeah, sure.
Okay, because I was cut a while ago. Yes, but I'm looking at politicized in a positive sense. Okay, for me, politics can be good if used positively. Now, the positive thing about what's happening in the U.S. right now is, as Professor Majar mentioned, so people are very much aware, even if there's a problem with COVID-19 in the US, a very high incidence, but people are on guard to protect their rights. And this is what we should really do. And with the situation that's happening right now, the moral ascendancy of President Trump is eroding, if it has not really eroded in the past. So it's continuously eroding. And even from his supporters among the Republicans, they have also become critical, including segments of the military or former military men. So I think this will be really a very big issue in the coming US presidential elections. The issue of how President Trump handled the COVID-19 pandemic in the US, that's number one, which I think is a failure. And secondly, how it has handled the issue of racism in the US and abuses by its own police forces. So this will be very big issues. And of course, former Vice President Joe Biden has come out in public, and former President Barack Obama has come into public, and it's really a very big contrast with the position being taken by President Trump. So people are now in the US, they really have to choose. Do I want a continuity of the present dispensation, or do we want to change the situation in the US? So it will be a very big political issue in the US.
Thank you, Professor Castro. So now I'd like to go, Dr. Daruni, that ma'am, you know, the mental health issue during this pandemic situation has become a very big concern worldwide. So what kind of impact, because the lockdown is happening everywhere in the whole world in a different manners or in a different way. So what kind of impact on mental health can be happened because of this lockdown, and how to get rid of this? What kind of things we can do to get rid of this mental stress or mental pressure? Please.
Thanks for the question. Okay, like okay, can you hear me? Yes.
I can hear you.
All right, I'm back. Okay. Can you hear me?
I can hear you. Yeah, I can hear you. Please.
Okay. I start now. Okay. I would like to share like my research. Okay. Maybe it's not answer you directly, but you can get answer from my research. Okay. Like during COVID-19, I got a chance, okay, to do some classroom research, which my first year university student is allowed 220 people, okay, 220 people. And I call this report, okay, is called The Impact of the COVID-19 Pandemic on University Students, okay, in Thailand, okay. And from this report is part of my big classroom research, okay. I before COVID-19, I have a chance like to teach them how to use cognitive skills. Okay, you familiar with cognitive skills? Okay, the cognitive skill that I talking about, okay, is originally from cognitive behavioral therapy. It's some sort of psychotherapy, but right now originally developed by Aaron Beck in USA, Pennsylvania. And right now it's become very popular in terms of evidence base, and it can modify to be like health promotion intervention in terms of individual, okay? Because right now when we talk about intervention, we hear a lot. We talk about like social intervention, okay? We talk about family intervention, but right now I will focus on individual intervention, okay? And focus on cognitive skill. Okay, the cognitive skill that I deliver to my student 220 allow a month or 2 months. Okay, I teach them and I get them to practice. Okay, composed of 3 cognitive skill. Okay, 3 major cognitive skill. But for this talk, I will share 1 cognitive skill because maybe we don't have time enough. Okay, the first cognitive skill that I taught them is the name is 5-part self-reflection. Okay, 5-part self-reflection. I will tell you more. Normally, if you like learn CBT, they will use this skill. The name of this skill is cross-sectional conceptualization. Okay, the name the real name is like cross-sectional conceptualization, but I try to use it more like simple, like 5-part self-reflection. Okay, let I tell you more what this kind of cognitive skill mean. 5-part self-reflection. Okay, in this skill, okay, I try to get the student to aware of their own 5-part. Okay, own 5-part. The first part is critical event that they have been faced during COVID-19. Okay, I get them to fill the 5-part form. Okay, once a week for 7 weeks from March till last week. Okay, every day, not every day, every week, students have to send me 1 form. Okay, 1 form. Okay, it's called 5-part self-reflection. Okay, what they fill in the first part is critical event. Okay, critical event that they have been faced. Okay, and that critical event lead them to have difficulty feelings. Okay, you with me when I talk about difficulty feeling? Maybe like they sad, they upset. Okay, they may be anger. Okay, angry or feel guilty or feel anxious. Okay, so every feeling, every difficulty feeling, I encourage them to write down. Okay, in part 2, when they face with critical event, okay, what they feel. Okay, after they face with that critical event. Okay, that part 2. Okay, and for part 3, okay, part 3 from 5-part, I encourage them to ask themselves what went through their mind. Okay, what went through their mind before they got that difficulty feelings. Like my student, okay, 1 person, I give you some example. They said that his critical event is he heard the Prime Minister talking on the news. Okay, and then he got some immediate difficulty feeling angry. Okay, angry Prime Minister. Okay, and then and he said that during that time I feel guilty as well. Okay, angry and guilty. Okay, so I encourage them to feel the part 3. What went through their mind when you said that you angry? What went through it? What went through your mind? How you angry with Prime Minister? What thought happening to you? Okay, and then the student feel, okay, what made him angry? And then he said that during the time, very short period of time, he also feel guilty because he angry. So I encourage them as well. What went through their mind? Why he feel guilty? Because he angry. Okay, is that make sense? Because in one moment, the student can have so many, a couple of feeling like fear, okay, angry or guilty. Okay, so I would like them to get in touch with their feeling and write them out. Okay, and rate how much intensity that he angry Prime Minister, how he fear, okay, fear feeling, or how much he guilty. Okay, and part 3, all the thought that the student got, just write down, okay, on the part 3. And then part 4 is behavior. What kind of his action? Okay, what kind of his action that he did? Okay, because this event, I encourage them to do self-reflection after a week. Okay, get them to choose 1 event. Okay, he said that the action that he did is he just open the Facebook and write down bad thing about Prime Minister on his own Facebook. Okay, say very bad thing, bad Prime Minister, how he did like this. Okay, that his behavior. So I encourage him to write down what kind of his action during this moment. Okay, and the part 5 is physical reaction. Okay, physical reaction is mean what his reaction physically that he cannot control. Some people say that I'm checking. Ajahn is mean lecturer. Okay, he write down that physical part 5 is I'm a little bit checking while typing bad something about Prime Minister. Okay, I'm checking. I can type properly. Okay, maybe I'm a little bit what's that called? Wet at his palm, his hand. Okay, or like his heart rate more faster than before. His breathing different. So I try him to get in touch with his physical reaction. So this is called 5-part model. Okay, one critical event. Okay, how this critical event lead him to have like different kind of feeling. Okay, and what went to their mind, a lot of thought, and what their action, his action, and what kind of physical reaction. So they write down all of these. Okay, different critical event. Okay, during COVID-19. Okay, once a week. So I got allowed right now 1,400 work from my 200 students. Okay, right now I'm in the state of analyze, okay, information. Okay, I did not finish. Okay, but I would like to tell you, and then I would like to tell you like some sort of information that I got. Okay, from 5-part, what kind of difficulty, feeling or event that our student face. Okay, so for difficulty feelings, can you guess? Like for yourself as a student during COVID-19, can you tell me what kind of feeling apart from angry your Prime Minister? What kind of feeling?
Answer. It is very tough to answer in this condition because I am not in that condition. So I don't know how can I answer that question.
Yeah, don't go out. Yeah, you cannot go out and you feel. What did you feel when you could not go out?
It's very frustrating, you know. It's very frustrating.
Yeah, frustrating. Yep, very good. Yeah, same as my student. We got frustration from the situation is I cannot go out. Ajahn, lecturer. Okay, I feel frustrating. Very good. Frustration. What else?
It's like
anxious.
Anger.
Anger. You know.
Anger. Yep.
Yeah.
Who that you anger with? Prime Minister or your lecturer?
Yes, Prime Minister, and with everyone. I that will make me angry, and I'll be angry with everyone, with my family members, with my co-workers, and even with the Prime Minister.
Yeah. Okay, very good. That's the same with my student. Angry family member, angry brother, sister, angry master try to invade their boundary. Okay, just knock on the door and not knock on the door, just come out to my student and said that, what did you do? Okay, you did not study. Okay, so students said that very upset about the behavior of like brother, sister, and some students said that I'm a witness. I have to be witness of fighting with my parents. Because when they went out going to study, they don't need to stay with their parents all the time, 24 hours. But when they stay with their parents, they say that they have to be witness, and they feel like frustration, sadness, okay, depressed. Okay, that's some example. Okay, angry, depressed. One student said that they feel depressed and don't want to live. Okay, don't want to stay in this world anymore because a lot of homework, overwhelmed with homework. Okay, too much homework. I don't know student in Bangladesh, because in Thailand, when we have to do online, okay, some lecturer stressful, and then one way that lecturer do is give a lot of homework to the student to make sure that student learn more. But for students, they said that they cannot cope with that because one lecturer gives more than 10 times amount of homework that they give to the student. So one student said that I don't want to be in this world anymore because of cannot cope with this like too much responsibility. Okay, so this is I try to give some example, okay, in my group of student, okay, and I got allowed 10% so far that I read 10%, okay, like 10 I read 10 people, 10 students, and 1 or 2 students say something about they angry prime minister, angry about the way that government, okay, manage the country. Okay, some students said that is that right? We got very good health, but the economic really going down, really going down. Okay, some students got some students, you still with me? Okay, some students said that very angry when they saw pupil suicide. We got, I think, maybe 2 or 3 pupil in Thailand suicide from COVID-19. Write down, okay, 1 pupil write down to prime minister because of the way that you manage, okay, the country, okay, and make she really suffering, okay. We don't know the detail, okay, but the news like it, she write down a letter before he commit suicide. Okay, my student just get furious and said that very bad how the government manage the situation like this. And then apart from that, we got in Thailand right now, we got we call like MC of government. He come to present how much of people catch the COVID every day. Okay, talk about the statistic. Okay, okay, talk every day around like half an hour. Okay, and the student said that many times that I really furious, angry, okay, about the MC because sometimes he talk something like he don't care why people die, just said that it's normal, okay, it's normal that people die during the COVID-19 because it's stressful situation. My student get furious, okay, and said that the MC person did not care, okay, about the pupil. So I just give some example, okay, like the critical event that lead my student to got some sort of difficulty feeling, okay, and then I don't know that I still have time. I still have time for this.
I'll come back to you. I think
or you like
question.
or everyone can see the picture.
Yeah. So I would like to come back to you after the other discussion. Okay, after the completion other discussion, I will hear about the
okay
remaining parts of your research.
Now, how long it will take? Daruni, can you finish it by 5 minutes? The result, or can you will be able to how much time you will need to finish?
Finish this one, is it? I mean, maybe a couple of minutes, okay? A couple of minutes, okay? So what's the meaning? Okay, so I would like to summarize, okay? What the meaning that I got from the result so far, okay? What's the meaning of my result? And my observation is, like, okay, student, like, they are normal person, okay? They are normal person, and they can learn, okay, how they got difficulty feeling. They can learn cognitive skill and calm them down, okay. The first one, okay, they can calm them down, okay, can manage their feeling, because like for the second and the third cognitive skill, I get them to calm them down while use Socratic questioning with himself or herself, okay, question about their thought, okay, and what did they decide, how did they calm themselves, okay, how did they change the thought, or they will keep the thought like this, or the action that they would like to do to make themselves better, Okay, that's the first observation from this research. Okay, and the second reason, okay, second things that I my observation is I found that like my student, okay, like 10% of students they can like they got like I don't know how to say the word. Okay, there is a health, okay, like they're not anthropology, okay, normally they're not anthropology, they're not sociology student, okay, they are health student, okay, normally they don't know much about something around them, they're first year student, okay, but I'm really glad that 10% we got our student that they got the lens to see inequity around them, okay, that's something that I feel very happy about this. Okay, normally when we see our Thai student, okay, in like mid best grade, best job, okay, best teaching, okay, best score, okay, they did not care much about what's going on, okay, in the world, okay, just interest about themselves, okay, when they see people poor, they say that just bad luck, something like that, because they don't help themselves enough. But for this research, I got 10% of students first year that they can see inequity, okay, around them. Okay, they see like marginalized people and they start to get question. They got like angry, okay, and would like to do something to make like our society better. Okay, that's my summary. Is that clear? Something that I make you feel confusing, just let me know.
No, it's clear. It's enough clear because
No,
you
this
have
was good. I
given,
mean, this was interesting finding.
yeah,
Thank you very
you have
much. Yeah.
you have given the examples which has made it so easy to understand the context of the
Yep.
students and their thought and their thought process. So that's very clear because how their emotions is working in that moment. Okay, so this is very clear and that's
Yep.
very interesting findings. Thank you, ma'am, for
Thank
sharing
you. Thank you
the
very much.
findings with us. Okay, so now I would like to go to Professor Nestor Castro. Sir, you have talked about the concept of illness or concept of pandemic. So, what do you think that in this pandemic situation, the responsible organization who are supposed to give the people the information about this disease or illness or the pandemic are uh, do they have done the enough job to inform the people the right information?
Um, so in the Philippines, we have an interagency task force on this pandemic, and many people. This is a government body. Many of the office officials who are in that office are former military men. Of course, there are people from the Department of Health, but many of them are not very familiar with social sciences, including how to communicate better with the public. What is the understanding of the public about this situation? And this is where a lot of communication problems arise. Understanding of what can be done, what cannot be done is quite confusing. The government sends out different signals depending on who is the person speaking. Sometimes the president will say, this is what you should do, and then another official will say, this is what you should do. So this makes it difficult. The messaging is quite difficult. And of course, expertise in communication is in the realm of the social sciences. Now, within health practitioners, of course, there are health practitioners also that would have a strong social science background, especially those in the realm of public health. They are the allies of social scientists. Now, going back to a question raised by Majar a while ago, he was saying that So how is the situation in the Philippines? Is it positive or is it negative? Do we have good examples? I think we have both. We have uh, we have a lot of failures, mainly initiatives by the national government. But we also have many possible initiatives coming from the local government. And this is quite different right now. So in the city where I'm living right now, this is Pasig. Our mayor is quite famous for his initiatives in dealing with the pandemic. And this is also being done in nearby cities within this national capital region. So we have both bad models and good models. Um, I hope if the situation improves, we could really assess what initiatives really impacted positively to the people and should be embedded in public health systems, because we will experience more pandemics in the future. If not COVID-19, maybe COVID-20, COVID-21, or another type of virus. So we hope that the positive lessons that we learn, as well as the negative ones, but learning from it positively, we could uh, input this in improving our health systems so that in the future we could better respond to a similar type of epidemic or pandemic.
Thank you, Professor. So now my last discussion with Professor Ekem Achur Islam. So I would like to ask you two questions. That first question is that there are in Bangladesh, the government has produced so many guidelines to protect the people from being infected with the COVID-19. So do you think that the guidelines are enough modified or enough prepared to make people safe in this COVID-19 situation? So this is my first question. The second question is that if the World Health Organization informed the people about the illness, the concept of illness or the pandemic, well, so why is the infodemic is happening? Because a few days ago, we have come to know that in Bangladesh, that who has informed the Bangladesh government that the virus remains only 3 hours after the death, but this has been informed by the has been informed. We have informed that by the government few days ago. So why this kind of infodemic is happening in this pandemic situation, sir?
Thank you, Shudipto. This is very important question because you see in this pandemic, this is called an infodemic as well, only because that we're jumbled so much with those information, misinformation, and disinformation that that sometimes becomes counterproductive for for the different section of population in different countries. This happens because we're learning each and every single day, and science doesn't give answers to every single thing in the world. I mean, you see, they have been saying that 3 feet, and then they're now saying that it is 2 meters. I mean, that's equivalent to 6 feet. The social, I mean, physical distancing thing. So I mean, it is a continuously evolving kind of a information flow that we are having even from the scientific community, because science do not have an ending of it. I mean, they are also, I mean, learning from the virus and the movement of the virus and the epidemiology of it. So you know, this virus has got kind of a mutation syndrome, and it mutated so many times in different environment and different atmosphere and climate. So it's not unexpected that we'll have some kind of a evolving information that comes from even the scientific sources. But the problem is that I understand your concern is that when excuse me, all kinds of information comes from all kinds of sources. I mean, we have got those national media, we have got now the social media, we have got the national level governmental information, and we have got their NGO non-governmental information. All kinds of this is so jumbled with so much of information. And if someone is into corona thing, what Daruni was advocating, that we have mental thing is very important. And if someone is paranoid with so much of information, kind of, I mean, somebody is eating so much of information. So that's
Yes,
that
I got
sometimes
yeah.
that sometimes make people really really confused, and that also a kind of a cause of frustration, that what to believe and what not to believe, and how to deal with this and how not to deal with this. And there are a lot of, as I said, a lot of misinformation also comes with that, which is called gossip and other things. So this is kind of a situation that the national government should filter all those things and come up with a guideline that is that should be followed by the citizens of respective governments. But as you see, that since it is evolving, and people of the world and even the scientific community is learning from day to day business, so there would be a lot of new information coming in. So we need to embrace new information, but we need to also understand what is misinformation and what is gossip. So that's not easy all the time. So there is a role of government here, where who will be the authority and the Ministry of Health and others, who are the ones who will filter the information, and give the citizens kind of an appropriate information. Having saying that, I just want to add to one or two points that I want to share with Dr. Castro and Dr. Daruni, is that you see that the way the pandemic is going on, and there is no end of it. I mean, it's kind of like new virus. There, you see, this is zoonotic, and there will be a lot of zoonotic viruses around in the next, in the course of times, because and most of the things are happening for one of the reasons is deforestation. Amazon has been ravaged, and a lot of forest around the world has been ravaged by the greed of the Homo sapien. And you see a lot of new kind of animals, which Homo sapien didn't have any clue that they're there. They are coming with new kind of viruses, and so deforestation is happening, and new viruses is coming up from animals. I mean, from these zoonotic sources. So if we cannot take some concerted efforts, and we cannot prepare for the future, that is something that we can learn from this pandemic, that we are really this pandemic has proved that we have been really unprepared for this kind of a disaster that may come. But this is not unanticipated. Scientists and the concerned section of the population was having that concern that this kind of pandemic may come, but when it comes, we see that we are not prepared of it. So do you think that particularly from anthropological or social science point of view, can we develop a kind of a knowledge a kind of a bank from different experience of different countries, where that we can have a colloquium of anthropological understanding, which may help the citizens of different nations to adopt with this kind of situation in future?
Great idea.
To whom is that question addressed? I think that's a very good suggestion, that this is a matter that should be taken up by anthropology. For example, looking at how traditional anthropology is, in the past, we go to the field, we do ethnographies, but now in a situation such as what we are witnessing right now, especially in the case in the Philippines, where we have a lockdown, we have a community quarantine, so we cannot go out to the field, but we could shift our field area virtually. So we should encourage virtual ethnographies. We could document lives of people using in the internet, using social media. We could have online diaries. And I totally agree that there should be a bank of all of this information so that we learn from each other. Again, of course, it's not just raw data. There is the role of anthropologists and other social scientists to process and analyze all of this data. And it should have an applied component. It's not just for academic purposes, but knowing these things, how do we input that into our policies and improve the systems that we have?
Yep. Yeah. For me,
Daruni, want to respond?
Yeah, I agree as well, Prof. Masa. Because like even if I got like mental health background, okay, or psychotherapy, and I learned a lot from anthropology as well, okay, like for my technique, okay, in cognitive technique, okay, right now we just only talk about like automatic thought, the surface level, okay, but actually we still got like deep down thoughts. It called a rule of living, okay, rule of living or assumption that the student or pupil got from culture, got from their like their own what's it called, childhood, something like that, or their friend, their relative, okay. So I think that this sort of anthropology will help me, okay, about like how to make a jigsaw, okay, to get the pupil to know about their deep down of the thought. Okay, because in psychology, normally they just know that, okay, we got some core belief, we got assumption. This thought or this core belief happening from when you interact with key person in your child life, okay, in your childhood life. But for anthropology, will help us with like how the culture shape us to have core belief like this, okay, the way that we see ourselves, we see others, we see the world. So I think mix of like social science will make the pupil got critical consciousness or understand themselves more. Yeah. Thank you. I think it's quite good idea. Yeah.
Thank you, Professor Castro and Professor Daruni and Professor Major Islamta, because we are at the end of our discussion. Because of our time limit, we have to end it here. So I'd like to thank once again Professor A.K. Major Islam sir for arranging such a nice and informative discussion session, and Professor Nestor Castro, Professor Daruni, and Professor Sabina Faiz Rashid. So thank you for joining us and for this nice and informative discussion. So those who are watching us and those who has been with us for this time period.
There is a question asked to Dr. Castro. Can you just refer to that?
Okay. Yeah, I'm really sorry for that. There's a question for Professor Castro that do you think government really may give any heed to the knowledge provided by the social scientists, considering the time frame and urgency?
I think even in the past, even before the COVID-19 pandemic, the government in many countries, including the Philippines, has not really been giving much importance to the social sciences. The social sciences is always second class to the physical sciences, the natural sciences. So that has been the system as how it was in the past, and it was heightened even in this situation now. Now I think situations of pandemics is an opportunity where different disciplines should come together Of course, understanding about medicine, you should understand biological processes, but you should also understand behavior, culture, psychology, history, etc. So there should be a bridge between the two. The question that says, because there's a matter of urgency, that's why we were not able to consult social scientists as well. But that highlights that the government is ill prepared. There are always epidemics and pandemics that happen. It's a cyclical thing. It will happen again and again. And it should be built into the system of tapping expertise of social scientists. The advantage of social scientists, because they study people, they have the link to the public. I think this is the strength of social science. Thank you.
Very good. Very good. Good to hear.
Thank you, Professor Nestor Castro, for your nice and informative answer to that question. So now I have to end it, though I have some interest to run this discussion for a long time, but because of some technical difficulties, I have to cut it short. So thank you all for joining, and thank you the audiences who has been with us for this time period. Hope to see you all. Stay well, stay safe. Till then, tata, bye bye.
Thank you. Thank you.
And thank you, Professor Castro and Dr. Daruni. We will see each other again when the pandemic is up. But in the meantime, let's keep in touch. I mean, in the meantime, let's keep in touch. All right.
Okay.
So thank you very much.
Thanks for the opportunity. Okay. Bye bye.
ขอบคุณครับ
ขอบคุณค่ะ